How many people in this room can remember the last time they washed their hands? With a little knowledge, we can all help better protect ourselves and our loved ones from becoming exposed to harmful bacteria in our community. My name is JMiller, and the purpose of this speech today is to heighten the audience's awareness about the MRSA infection. Today I will be giving you a little bit of background information about MRSA, the signs and symptoms of the infection, and something you can all do to better protect yourself from becoming infected. First of all, I would like to start by giving you all a little background information about MRSA. According to an article, What is MRSA?, written February 25th, 2013 by Christian Nordquist in medicalnewstoday.com and retrieved on July 10, 2013. MRSA stands for methicillin-resistant Staphylococcus aureus. The term is used to describe a number of strains of bacteria that are resistant to a number of antibiotics, including methicillin. It was first discovered in the 1960s and later became prevalent in the community in the 1990s. When it was first discovered, it was considered to be a hospital-acquired infection. It was oftentimes seen with people who were having surgery done at the hospital or having any other kind of invasive procedures. It was later seen in the community in the 90s with people going to the gym or people involved in sports, and it's often very prevalent in the jail setting. So there's two types. There's hospital-acquired and community-acquired. Even this tiny bacteria is hard to see, but if you become infected with MRSA, it can mean a big deal and be a big problem for your health. Which brings me to the next point, the signs and symptoms of MRSA. MRSA infection of the skin starts as a small red bump that resemble pimples, boils, or spider bites. And often these symptoms, oftentimes they develop as pimples, but we carry MRSA underneath our skin or underneath our fingernails, and a lot of times if we scratch these areas, they can become infected with the MRSA infection. So you just have to be careful about touching in contaminated areas. This can lead to potentially life-threatening infections of the bones, joints, surgical wounds, and it can even spread to the bloodstream, the heart valves, and even to the lungs. Early recognition and prompt treatment of the infection will reduce the risk of systemic infections. In an article written by Alina Joseph, a MD, titled MRSA, published August 2011 by kidshealth.com, retrieved on July 10, 2013. You should seek medical attention if you start to have any signs of swelling, redness, or warmth over an area, or if you have a pus-filled blister, or if you develop a fever, body aches, you should go to your doctor. Or if there's an infection that seems to be passing from one person in your family to another, or from, like if you have a bunch of kids all with the same type of symptoms in the school, you should seek medical attention. And now that we see the devastating effects of the bacteria, I'm going to let everyone see how we can further prevent getting this infection. According to an article published in June 9, 2011 by MayoClinic.com, titled Staph Infections, retrieved on July 10, 2013, the best way to prevent contracting the MRSA is to keep your hands clean by washing them thoroughly with soap and water. Scrub them briskly for at least 20 seconds and then let them dry, or use a disposable towel and another towel to turn off any faucets that you might come in contact, and use a paper towel to open any doors that you may come in contact with when leaving the bathroom. When you don't have access to soap and water, you should keep a bottle of hand sanitizer with at least 62% alcohol and use that to clean your hands, especially if you're touching a shopping cart and you're coming out of the grocery store. You should try to wash your hands because you don't know who was touching that last. You should always shower promptly after exercising, You should keep any open areas or wounds covered and clean when you're going outside. And avoid sharing any personal items such as towels, washcloths, razors, and any clothes or anything that come in contact with possible MRSA infection should be washed with hot water and use laundry detergent and bleach if possible, and they should be dried on high heat. So by heightening your awareness about the MRSA infection today, I hope you have all learned how to further protect yourselves and your loved ones in the future. I'm sure that after this presentation, we'll all be able to remember about washing our hands a little more often. Thank you.